right. Pew 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 pew. Hi everybody. We're just gonna start at the top here with some good energy. It's great to be here with you all. It's so exciting to have all of you with us and to take some time out of your long weekend holiday. We love a second Monday, don't we? But thank you for being here today and spending some time with us. We're gonna have some fun. We're gonna learn a lot as well. But quick welcome. Hi, everyone. Welcome to Donate with Pride, powered by America's Blood Centers and GLAAD. My name is Tony Morrison, Tony with a Y Morrison. I'm a senior director at GLAAD, which is the national LGBTQ nonprofit organization leading on LGBTQ representation in media and entertainment, from film, television, advertising, tech platform safety, journalism, and more, and getting LGBTQ stories and issues told accurately and fairly across those mediums, industries, and spaces. So that includes getting the word out on expanding the blood donor pool in this way, and making sure that we're working together to make that happen, but also tell these stories, which is why we're gathering here today. Um, Sounds almost like a wedding, sorry, but the webinar's purpose is to bring together members of our community who are motivated to save lives by giving blood. Now, today, especially as we enter into Pride Month this year, I know it can feel fairly stressful, fairly ominous time for us as well, but I would venture to say it's a prime time to come together in ways like this, to share ways we can give back to the communities we serve, we want to serve, and super serve in ways up and over what's typically top of mind for us. So, what a better way to give back to the community than to quite literally save lives. So, with that, I actually, let's see, who am I handing things off to? I think to Diane. I'm trying to stick to my run of show, but
Yep.
I'm a professional yapper, so I just like to take it. But Diane, please take us through a little bit of the background eligibility changes. We have a great program lined up for everyone. We have some special guests, but I will leave it to Diane to take us through, um,
Well,
yeah,
thank you
chapter
so much,
one.
Tony. I'm not sure I can quite match that energy, but I'm going to do my best. So thank you all for being here today. I'm just going to go over a little bit about the changes and how you can work to support the blood supply. If I can get my slides to, there we go. So the first thing I want to do is tell you a little bit about the process of donating blood. I think this is something we all kind of a little bit know, but just to put it out there so that you know what to expect when you go to donate blood. So the first thing is the US blood supply is really about altruistic donors who literally give of themselves to help strangers that they will probably never ever meet, never hear about how their blood was used, but they really, giving back to that community is such an important piece of it. Your time as a donor will start with a simple physical exam and some screening questions. These are the same questions and the same exam that's given to absolutely everyone who comes through the door to donate. These questions and this exam is about not only the safety of the recipient who may receive your blood product, but also the safety of you as a donor, because we want to make sure that you are healthy and able to donate blood. The next thing is that they'll actually put the needle in and take the blood. And as they do that, they fill up tubes just as you would get probably at like a doctor's office. Those tubes are then sent for laboratory testing for a number of infectious diseases. Again, everybody's blood is tested this way. And then it proceeds to be processed. Oftentimes, blood is used in its component parts. So red blood cells are kind of the thing everybody thinks about when they think about blood, but they also have them as platelets and plasma, and those are other components that are used for transfusion to patients. A label is put on there so we can always track. It is all tracked through computer systems to make sure if there's any sort of issues, we can track back to that donor. we can track to that recipient and make sure that that safety is kept intact. The final step is distributing to the healthcare facility where that blood is actually used to impact somebody's life on a day that is probably not the best day of their lives. You as a donor can step in and help to save or improve their lives. So a couple of things to keep in mind. This process is very strictly regulated by the FDA. Your blood donor center didn't come up with this process. They didn't come up with these questions. This is what the FDA has set out and has approved every single step along that process. And so we, as the blood donor centers, are in the same position as you are in advocating to the FDA when we see things that need to be changed. Those changes just can't be unilaterally made by that blood donor site. There is, as I said, extensive oversight from everything from the computer system that is used to track the donor to the blood bags that are used. Everything is regulated by FDA. And blood centers have been advocating for a long time. And I know we've worked with Tony and GLAAD and other organizations to really get the word out as changes have been needed. And we continue to advocate with FDA for additional changes. So a little bit on the history of the LGBTQ plus community and their history of blood donation. One thing I think is really, really important to point out is that prior to 1983, gay and bisexual men were oftentimes in a lot of communities very dedicated blood donors. And that's something I think is often lost in the narrative, and I think is really important to note. In 1983, FDA implemented a lifetime deferral based on risk for HIV or AIDS, as it was discussed with at the time. A number of things were included in this. The reason for this deferral initially was we had no test. There was no way to test the blood to determine whether it was or was not safe. And therefore, the determination was made by FDA to use statistics. That was the best tool they had in their toolbox, and that was what they did. A number of tests between 1983 and 2002 came online, and those were varying levels of effectiveness in testing quickly and finding good answers. In 2002, FDA approved what is called the nucleic acid or NAT test, and this really is the gold standard in terms of testing, and it tests for the body's actual DNA and RNA of the virus and not the body's immune response to it. And that's really important because it reduces the amount of time that it takes to be able to find out whether somebody is infectious. It took 13 years for FDA, and I just want to highlight how long it took for FDA to make any change to that deferral process, even though we had a very, very good and accurate test. During this time, blood centers, ABCs, our individual member centers, were working with FDA, trying very hard to get this change made. FDA is a slow-moving machine, and it took until 2015 to even reduce it to a one-year deferral. That was then in 2020 was changed to a 3-month deferral. This really was FDA taking advantage of the additional authorities they got because of COVID to really shorten that time down. And then in 2023, we saw finally the change that we had been pushing so hard for, which was moving away from looking at somebody's sexual orientation as a category, but instead looking at, let's say, what are broadly for every single person, what are the risky activities and the level of risk based on that. And so we now have a universal donor questionnaire that is asked of every single person. So what are those questions? So you're going to get a lot of questions. There are going to be questions about your travel history, about your health history. There is now an additional question of, have you had sexual contact with a new partner or sexual contact with more than one partner? If you answer yes to either of these questions, regardless of who you are, the 83-year-old grandma comes in to donate blood and she's going to be asked these questions, and then the follow-up question of, did you have anal sex with those partners? If the answer is yes, you will be deferred for 3 months from the date of contact, or from the date of the deferral if you don't know the date of that last contact. All donors, again, are asked these questions. So where did they get these questions? So this really came from a 2014 study. I've included it here in case you want to go see a little more information about it, but it really goes through a whole list of risks for HIV and looks at the statistical probabilities based on each of those actions. FDA used that to determine where that line should be drawn. Couple of important things to remember. This questionnaire has to be simple. The questions have to be easy to understand, easy to ask. And it really has been drawn on the experience that the UK and Canada had in making this change before the United States did. The goal really is to reduce the number of unnecessary deferrals. The previous policies were way over deferring people based on the safety of those donors. There was no reason to defer most of those individuals. This is really designed to reduce those deferrals. Additionally, we want to make sure moving forward that we don't just stop here, that we continue to say what is the newest, best research, and let's make sure our questions continue to reflect that. So if we're already testing, as I said we are, why are we deferring people based on these questions? And the answer is something called the window period. And what that means is from the moment somebody gets infected with HIV, there is still a lag in time between when that infection occurs and when that can be picked up by the test. So the questions are really designed to catch people in that window period before the test would be able to tell whether or not they are infectious based on that contact. An important thing to remember is that risk for blood donation is very different than risk for sexual contact. So the U equals U, undetectable is transmissible, works for sexual contact. It is not the same for a blood donation. And if you really think about it, it makes sense. The exchange of potential for passing a virus on during sexual contact is much less than when you take a literal bag of blood and put it right into another individual. A very low amount of virus would be transmissible at that point. So there are very different thresholds. The U equals U works for sexual contact, but not for blood donation. So it's important that we continue, as I mentioned, to continually look at these tests as we get better tests over time, making sure that we are continuing to improve and reduce deferrals based on those criteria as they come in so that we can make sure that the most people have the ability to save lives through blood donation. One of the questions that always comes up is the fact that there is a deferral based on the use of PEP or PrEP. So if you are on oral PrEP, there's a 3-month deferral from the last dosage. For injectable PrEP, it's 2 years from the last injection. The reason for this is actually a medication deferral. It's because these medications are so effective that they actually interfere with the accuracy of the test. So the tests that blood centers are using to test that blood indicate that they are not a valid test if somebody is on PEP or PrEP. And so that really is the reason. It's not about the individual taking the medication or anything that they are or are not doing, but it is about the accuracy and the ability of that test to detect if there is a case that comes through. It is really important that we emphasize that all the messaging emphasizes that the decision that you and your provider make needs to not be modified in order to donate blood. There are other ways that you can support the blood supply moving forward. We'll talk a little bit about those, but you should always continue to utilize your medications as prescribed by your doctor. Your health needs to be your first concern. So let's talk a little bit about what you can do to help support the blood supply. These recent changes, there's still a lot of people who don't understand what the changes have been made, what the questions that will be asked, how this process looks going forward. So as somebody who is an influencer who knows the answers to those questions, you can always reach out to me if you get questions that you can't answer, and we're happy to share additional information. But having those conversations with people, obviously, It's always important. If you are eligible to donate blood, schedule an appointment today. Call Donate Today, schedule an appointment today. When you do donate, spread the word. I know for a lot of people, they're like, well, I don't want everybody to think that I'm saying how great I am because I'm out donating blood. But really, by normalizing the process of blood donation, it can take away some concerns people have about, the needles involved, what the process looks like. It gives them somebody that they can reach out and ask questions to. So your willingness to share your experience as a blood donor can be a huge part of reducing stigma surrounding blood donation, and work with improving the blood supply. You can also partner with your local blood center to help them put out accurate information and to reach into the LGBTQ community, and using words that and images that really work for the community. I think sometimes blood centers may try to reach out to those communities, and we want to make sure that they have all the resources they need to reach into your communities. Finally, you can host a blood drive. Bring in people that you know. The most common reason that we see in surveys for why people say they don't donate blood is it's because they're not asked. So you can be the person that does the asking, and more importantly, you can be that trusted source of information. So you can answer the questions. How did this process go? How much did the needle hurt? Was it awkward? Was it whatever those questions that somebody may have? Having somebody that they are comfortable asking those questions to can be a huge way to get somebody to actually come in and donate blood. Effective outreach. So these are things you guys all know. You don't need to hear them from me, but you're going to hear them from me anyways. Really, the language, the imagery that reaches your community, and make sure that those are the words that you're using. Be prepared to answer questions. A lot of people don't know how this process works, especially if they've never done it before. Just hearing the word needle is a little scary for a lot of people. I will be the first person. Everybody on staff always laughs because I am totally needle phobic. And it's a little ironic that I ended up working for, for the blood supply, but having someone that you can ask those questions to. How much did it hurt? What was the process like? How long did it take? All of those things, those are questions you can ask from your personal experience, and that can make somebody else much more comfortable walking in the door to donate blood. Host that blood drive. Make it an experience where you can create the experience that works for those within your communities. We are happy to do anything at America's Blood Centers. We can connect you with your local blood center to help you get that word out, help you feel more comfortable sharing your experience. So I appreciate all of you being on this call. Appreciate all of the blood donors who are willing to share their experience. This is such an important part of expanding the blood supply and making sure that blood is always available when and where it's needed, because ultimately that is the goal, is to make sure that anytime somebody needs a blood transfusion of any of the products, it is there and it is available for them. This is something that is often not thought about by everyday individuals because they've never needed to think about it. They know that if something happens to them, the blood is going to be there and on the shelves. It's only there and on the shelves if you go out and donate. So please support the blood supply. And I'm happy to answer any questions that anyone has, but if not, I will pass it back to you, Tony.
Thank you, Diane. You are an icon as always. Thank you for sharing all of that. And yes, I see a couple questions coming in on the Q&A feature. And also, if you all have any questions while we're having these conversations, please go ahead and use that or just drop into the chat. I know some of the team will get to them live, but we are also going to stack some for a Q&A session that we have at the end here. So we will get to it. And I was looking through the attendees list. It's so great to see some familiar names and faces. But next, we're going to take you through a few donor experiences. We have three amazing folks who have raised their hands to share their story which we love because your stories are your superpower. So you can listen to us, dish out these slides and information and data all day. But I know that what is really powerful and what can help you tell your stories in your communities, and where you are in your places of work as well, is to hear things firsthand. So first up, we'll bring up Michael. Can unmute and Michael's ready to go. I'll hand it over
Yes.
to you, my friend. Thanks
All
for
right.
being here with us.
Yes, thank you for having me. I'm Michael, and I've been with Gulf Coast Blood since 2021. And from day one, I really was inspired by the mission, the life-saving work that we do, and the incredible stories that I got to help share as a communications coordinator, working as a communications coordinator at that time. These are stories of hope, survival, and community. But there was also something personal for me is that I couldn't donate blood. As we know, at the time, the FDA guidelines prevented many gay men, including me, from giving. So while I was sharing powerful stories and meeting grateful recipients, the folks who received the blood transfusion, I couldn't take part in the very thing that we were asking others to do. And that was kind of tough. Like I was on the outside of something I deeply believed in. I couldn't practice what I preach, right? Um, then in 2023, as we know, everything changed. The FDA updated its guidelines to focus on individual health and behavior, not identity. So now everyone's getting asked the same questions, regardless of who you are, what you identify as. And for me and my husband, which you'll hear from him in a few minutes, that shift meant something huge. We could finally donate, and we did together in December of 2023. And that first donation was empowering, and it was something so cool to be part of that experience with him. We do donate. Today, I'm actually a regular platelet donor because I have that A positive blood type. And I encourage others to make donating a part of their routine too, because the need, it is real. Blood can't be manufactured. It has to be given from another human. Here at Gulf Coast Blood Center in Houston, we support over 170 hospitals and healthcare institutions. And we serve one of the largest medical centers in the world. And we need 1,000 donations every day to make sure that we have the blood on the shelves to meet the need of the patients. That's a huge ask for the community. But behind that number are cancer patients, trauma victims, premature babies. What else? Transplant recipients. These are real people with real needs. And the truth is, recipients, they never ask who actually donated the blood. I promise you, I've spoken with them over the years. They just hope that the blood is there. I've met so many of them, kids who receive blood transfusions, parents who receive blood transfusions, grandparents. They're just so simply grateful that someone showed up, someone gave them an hour of their time, and someone gave a part of themselves to a complete stranger. And now that someone can be any of us. So if you ever thought about donating, I hope you'll take that step. It's simple, it matters, and it truly, truly changes lives. Not for just that person receiving the transfusion, but the family or the community. So I'm proud to be a donor. I'm proud to work at a place that saves lives. I'm proud that now I get to live the mission that I've always believed in. Thank you.
Thank you, Michael. Thanks for all that you do. Lewis and then Dylan.
Hey everyone. So I'm the husband. I'm Michael's husband. I'm Luis, and I am also excited to share my story, which is very similar to what Michael was just saying, how it shaped me and how it challenged me at the same time, and how ultimately now it empowered me. So my first real encounter with blood donation, I remember I was probably a teenager, and at that time my grandma was at the hospital. She needed a blood transfusion. Now, my grandma was actually in a hospital in Mexico, and in Mexico you could actually family members can donate blood directly. And I remember my dad and his brothers and sisters, basically his siblings, um, donating blood. They, without any hesitation, they jumped in, rolled up their sleeves, and they actually ended up donating blood. Again, I was a teenager. I knew about blood donation, but it really changed the way I saw blood donation for the first time as a teenager. It literally saved my grandma's life. So to me, it was something inspiring. It was something that I wanted to do. And it just, it stuck with me, and I knew that one day I wanted to save someone's life. So later in life, I was probably in my first job in my 20s. The company where I worked at that time, they were actually hosting a mobile blood drive. And I was excited. It was my first time donating blood. And what I thought it was going to be a moment of, donating blood for the first time, it ended up being a moment of rejection. And at that time, I was so naive. I had no idea about the FDA guidelines. And like Diane mentioned, some of the questions were overwhelming. So as I turned in, the paperwork, I was actually denied. And to me, I was turned away. I was confused. Um, I was angry at the same time. And I didn't get to donate blood, and it was devastating for me at that time. And I remember that, over the course of probably the next 5 or 6 years working at the same company, when the company would host blood drives, even my coworkers would ask, "Are you donating blood this time?" And I would avoid the question. I would sometimes just say, "Well, I'm doing something else today. I can't donate blood." I just felt ashamed. I think there was a sense of me that my blood wasn't, good enough. Again, I was naive. I had no idea about the guidelines, so I was turned away, and it was devastating for me. And it's something that I carried for that hurt for many years. I really did. And it was a reminder, at least to me, that while I wanted to save lives, I wasn't allowed to contribute. I wasn't allowed to be part of that contribution. But everything changed in 2023 once the FDA updated the guidelines. For the first time, I felt that I wasn't excluded. And like Michael mentioned, it was December of 2023. Both Michael and I remember that we scheduled our appointment and we donated blood for the very first time. And for me, it was a moment of healing, empowerment, and purpose. I mean, I think for me, it was something that I've always believed. I've always wanted to help others. I always wanted to donate blood. So I had come full circle for me, from a kid watching my dad donating blood to a full grown man now being able to donate blood for the very first time. So I think for me at that time, it wasn't just about the actual donation. It was about dignity, purpose, and feeling, that I belonged, that I could also donate my own blood. So now I am proud to say that I am a donor. Not as frequent as Michael would want me to at times. I do donate 3 or 4 times a year. There's times where Michael tells me, "Hey, it's the weekend. Let's donate blood." So I think I could probably do a better job, and I will. And one thing that we're doing actually for us to kick off Pride Month, we are actually donating blood. We have our appointment scheduled for next week, and that's how we are going to kick off Pride Month. We're gonna donate blood as a couple again. And my message to all of you is just to consider donating blood as we kick off Pride Month. I mean, there's so many things that you can do. There's a lot of lives that you can change. So consider donating blood in your local community. To me, it is changing lives, saving lives. And yeah, and that's actually my story.
I love that. What a great way to celebrate Pride indeed, than to donate as a couple. I need to find a man so I can donate as a couple as well. Add that to my Pride list. Dylan, take us home from this section and save them from me, please.
Thank you all. Of course, I have to give a big shout out to ABC and GLAAD and Vitalant for allowing me to do this today. So my name is Dylan. I go by Dill. I work here at Vitalant. I've been here about 8 years. I've worked in manufacturing research and now donor recruitment. I'm an account manager here. But my connection to blood banking did not start with this job. It actually started with my mom. She was a phlebotomist for our legacy center, Bonfils Blood Center, for almost 20 years. And so I kind of grew up watching her, put on her scrubs and, go out in the community. She just had such a deep sense of purpose and a drive to show up for the community. And of course, an unwavering belief in the impact of what we can do. I just remember she talked about blood donors like they were heroes, and the patients that we serve like they were our own family. And I think that spirit really shaped me and in my career. She introduced me to the world of blood banking, not just as a career, but as my calling. And so I'm very proud to continue that work at the same organization because of the foundation that she laid. Obviously, as a gay man, I felt like an outsider to the mission, kind of like Michael was saying. For the first 5 years of my career, I wasn't allowed to donate regardless of my health or who I was or my intent. It kind of felt like a very quiet kind of exclusion. And even though I worked in this field, it always kind of stung knowing that, again, I couldn't do the very thing that I spent, 40, 50 hours a week encouraging everyone else to do. Of course, when the guidance finally changed, and I have to shout out the Vitalant Research Institute, who was a key partner in getting that changed with the FDA. It was more than policy change, it was personal for me. And when I made that first appointment to sit, in the donor center where my late mom had been working, I donated, and a piece of myself that had just been waiting for so long was finally welcome. And that was such a surreal moment for me. Um, so like I said, in my current role, I get to connect with businesses and community partners and blood donors every day. I get to go out and educate the community. I get to do things like this where we can share our story about, donating blood as a gay or bisexual man, sharing my personal story and kind of helping shape the future of donor recruitment. As we all know, we are kind of in a tricky spot, where we have donors that are aging out. We have kind of a need to bring in a new donor base. And I think specifically the LGBTQ plus community is such an untapped group that can really help us drive forward that growth that we need. I mean, the gay and bisexual men community, we are so community driven that something as simple as this could make such a huge impact. And that's kind of my hope as we move forward. So, moving forward, my mom did pass last year, but I think about her constantly, especially when I get to walk into our donor centers or talk to a new blood drive coordinator. This work is a thread that connects all of us, and it is literally as simple as, giving an hour of your time. Um, she once held the arms of countless donors, and now I get to help kind of carry that torch. So I share my story today with my mom and my identity and the impact because it's not separate. They do coexist. Every time we open the door wider, especially for our LGBTQ plus donors, for people of color, or for anyone who has ever felt excluded or on the outside of what we do in this industry, we can move our mission closer to what it was always meant to be, life-saving, period. I highly recommend, like, if you cannot donate, there are still so many ways that you can make an impact. Host a blood drive, donate to your local, blood center foundation. Just spread the word, like Diane was saying. I'm just very I encourage all of you to just kind of take a step back and think about the larger impact that you can make. So thank you all very much.
Thank you, Dylan, for sharing that, and I'm sharing in some of the flowers you are getting along with the with Michael and Lewis also in the chat. So thank you for sharing that. Um, we're gonna go right into a Q&A session here with everyone. I have a few questions of my own, but I will also love to bring online Dr. Jed Borland as well and Diane. Hey, you two. So I have a couple questions for a little bit of a round robin, and we'll get to some of the questions in the Q&A that's in here in the chat as well. So if anyone watching has a few additional questions, please drop that into the chat. We'll get to them. Dylan, I do want to start with you real quick. Donating blood is so meaningful, and there's an infinite amount of stories like yours that has such depth and, I guess, history. That there's such rich story and purpose in all that you shared, and that's the case with pretty much everyone that gives blood. Like, there is always a story, and stories that really invite us all in to also join in that purpose. What do you think though makes makes people most hesitant about the process or giving blood? That's probably a packed question, but just hearing you share your story, it's like, yeah, I want to start a blood drive. I want to buy a blood mobile myself. Like, let's go. There's such motivation behind it. But what do you think is top of list for hesitants and worries, if you will?
I honestly think, especially, you said it's kind of a packed question. If we were to break it down by layers, I think for what we are talking about today, it is the unknown, that this guidance has changed, that there's just kind of a lack of education and awareness around blood donation in its entirety. And whether that is just from understanding the impact or if you can or cannot donate, I just think there is still a lot of room for this industry to catch up in how we are reaching out to the community and making that, educational investment into the community so that they know the ins and outs of the process. And honestly, like kind of this first slide said, it starts with, well, nobody asked me. I've never been asked to donate blood. So you kind of have to have, a personal ambassadorship and reaching out to your friends and your groups and say, hey, yeah, let's host a blood drive. I asked my friends at Lifetime Fitness, let's host a blood drive, and we did, and we got, 20 units of blood from it. So it
That's
just
great.
comes down to kind of taking the initiative and spreading the education and awareness.
I love that. Thank you. And I think a key point there is just asking around, right? Even it doesn't have to be a community center or a local nonprofit. Even those are great places to start. But it could be just as simple as a running club or a fitness center, or I don't know if there's some mall walkers on here. Like just get your community get your community together and make it happen. So I love that. Lewis, you mentioned being devastated, is the word you used, finding out not being able to be eligible to give blood, and what you shared. What was that experience also something you had to share, or kind of walk me through like that moment of finding out? Was it with someone at a blood center, or
Yeah, so I mean the blood center again, they were doing their job. So by
yeah,
all means, I don't think it was the actual individual. It was, they mentioned, hey, based on the way you answer your questions, you're not eligible to donate at this time. And they couldn't give me an answer other than you're not eligible to donate. So that's the reason why I was confused, right? I'm like, well, what did I answer wrong? I had no clue. So that's the reason why I was devastated. I think I was looking forward to donating blood and not being able to donate blood. It was just a sense of being ashamed, being devastated, because I didn't know. It goes down to not knowing the answers for me at that time. After that, then obviously I ended up doing my own research, and then I found out, okay, now I know why I can donate blood. But I think for me, though, being in my early 20s, it was just devastating for me not being able to donate blood at that time.
and I asked that not to uh, have you unpack your trauma for us in real time. I'm sorry. But I think it's important for us to contextualize what your experience was. And again, this is not to slam, the blood centers or that provider in any way, but it really is to hone in on knowing what your experience was at that time, and maybe it is a little bit of a way to right the ship or just to learn from our past sort of thing. But that's what I was trying to ask of that is there's again like infinite amount of experiences like that and the reality is, and this is the beauty of having an ADC and GLAAD work together in this regard, is to your point what you just said, that provider or uh, blood donor location maybe didn't have the tools to share that
To
that deferral
exactly
with you in a
to
way
guide
that
me through
was
that process.
sensitive, and so those are
Exactly.
all of the pieces that we're putting together now and moving forward as a community. And on that, actually, Michael, from a staff and leadership perspective, when you have guidance and updates like this that are far impacting, um, and really do expand the blood supply and pool. Um, Again, I'm asking a lot of loaded questions of the group today, but what what happens? What's the process? I imagine like updates like this don't happen overnight. Um, and updates and guidance that are far reaching, far impacting, I don't think happen very often either.
Right. No, they don't. And, every blood center is different on their timeline. But for us, even though these guidelines change, it took quite some time to implement in our systems at Gulf Coast Blood. Change everything, change, when it comes down to the copy, to the phlebotomist, to the internal communication. Everything starts like internal under a project. And once that's done, then it's like, how do we spread the word to the community? Especially a community that probably wasn't so. I don't want to say like with Luis's story, like he got turned away. Well, because of who he is, and so how do you say, oh well, sorry, but now things have changed and we're going to do it this way. So
Mhm.
it took a lot of effort, especially in the external communication. Like last year we had a booth at Pride where we had pamphlets where we reach out to our LGBTQ community centers here in Houston. And, probably not seeing the kind of turnout like we would like to see. So there's still a lot of work to be done, and it's a process, and it's just going to take stuff like a webinar like this with GLAAD and ABC, and continue and working on the outreach.
It's great. And thank you for taking us in behind the curtain a little bit, because I think it's important to unpack what all goes into getting the word out, but also in the name of getting it right, for our community. And I think that's important. So thank you for that. Um, Dr. Corlin, you're up, my friend. I didn't forget you too, but there's a lot of questions about prep. So just I would love to just like take that on directly here. And there was a couple questions in the Q&A I've gotten here. I'll just read one verbatim. Shouldn't the effectiveness of prep be a basis for making a more secure blood donation? The chances of HIV transmission in PrEP users, including injectables, are anecdotal, or is there new data to support this? So if you could help us unpack the PrEP of it all, real quick, and from your perspective, from a medical lens.
Sure. I do not work for the FDA, but I certainly work with the FDA. And I must say, the FDA under the previous administration actually funded a study called the ADVANCE study, which actually was a wonderful collaboration with the LGBTQ community, FDA, and blood centers. And it was a very large and long study, and helped confirm some of the risk factors that helped eliminate any questions. There are no questions about men having sex with men. So let me just reiterate, those questions are gone. And kudos to the FDA for doing the study that allowed elimination of those questions. There were some, basically, it was studying new onset HIV, and there were some people who were on PrEP. So PrEP is really, really good, and it is really, really preventing a whole lot of new HIV cases. But there are breakthrough cases. So that's the first point. The second is, when we do a blood transfusion, it's half a quart. We're taking a pint from the donor. We are testing literally one drop. So an ounce is 30 milliliters. We are testing 1/20th to 1/10th of a milliliter. So we're testing a drop of blood. So the fact that we don't see HIV in the drop of blood doesn't mean that there's not HIV in the bag. And so the limit of detection of the test is down to somewhere between 10 and 100 HIV particles per mil. We're testing a fraction of a mil. And if there's one particle in the whole bag, which is 500 mils, that can transmit HIV. So, as Diane mentioned, um, uh, the amount of blood that can be exchanged during sex is in measured in drops. But unfortunately, the amount that we're transfusing is orders of magnitude more, and that's why it does not. Um, that's why it does not work to extend the U equals U to blood transfusion. So we'd love to eliminate that deferral. And then I was also the chair of the transfusion transmitted disease committee that reviewed how long PEP or PrEP stays in the system. And the reason it's a 3-month deferral for oral PrEP is it disappears reasonably fast. The 2-year deferral came from the fact that the injectable PrEP can hang around for a year or more. And the limits of detection, um, uh, it is several weeks after acquisition of HIV on average, but the test could take as long as 3 months. And that's the reason for the 3-month deferral. And I will shut up here.
No, that I was like, keep going, keep going. That's great. 'Cause you really had answered another question that was in the Q&A also that was talking really about HIV detection and the window periods. So the detection in 10 days and the 3-month deferral. So thank you for getting into that for us. I love the medical professionals because I literally have to say nothing because you you all you hit it out of the park and cover it all. So thank you. One more question from me. I'll throw this one to you, Diane, as well. I'll share with the group. For those who don't know, I was first introduced with the team at ABC when I was a reporter at ABC News. That one kind of writes itself. When we were working together on blood eligibility for COVID-19 survivors, gay, who are not able to donate their plasma after getting COVID. So we connected together on the blood center level and telling those stories when I was a reporter. But what I'm getting to here is, and something I would love for you to reiterate, Diane, is that from the blood center level perspective, asking for this expanded pool and to move to the individual risk assessment, it was not a new ask of you all, of the FDA. So if you could take us through that, that was a learning curve for me as well, that division of labor and purpose. But you all had been calling for these guidelines for a long time.
Absolutely. So the blood centers want to maximize the number of people that can safely donate blood, both the safety of the donor and the recipient. And so as soon as there was a test that was a reasonable test, that was a reliable test, the blood centers have been pushing FDA to make this change because ultimately this is about getting blood available for patients. And so there's no reason, as we were looking at the evidence and the science behind it, the blood centers are saying there's no reason for the way that you are doing these deferrals at this point. And I know when I was speaking, I said it took from having a reliable NAT test. It took 13 years before they were willing to reduce the deferral down to 1 year. And 13 years of blood centers sitting back and saying, what are you doing, FDA? We have the evidence, the science. And frankly, moving forward, that's something blood centers are going to continue to look for. When do we have the evidence that demonstrates, to Jed's point, the safety of being able to donate with PEP or PrEP? Watching those milestones, making sure, keeping FDA to task to make sure that they're keeping up with the best science that is available. So blood centers have been there making this case. We're there. We're continuing to make the case, and we will continue to make sure that we are advocating for the most up-to-date science.
Period. And that's on period. I do have a question that came in while you were speaking. Um, I might end up taking this one, but the question is, do you have any advice for sharing guideline changes with the LGBTQIA plus community and encouraging donating when blood donation may not be top of mind? This is coming from a marketing department looking to grow the donor base. Yes. So number one is I believe we have available some co-branded collateral. Jeff, don't yell at me. About frequently asked questions, of course, at the link that's in the chat, and I'll drop it in here again. But definitely a good place to start is the americasblood.org/donate with pride. That's a good place to start there and reach out to us for ways we can help customize getting the word out because it really is community focused and community centric. Michael, I might tap you in here also because you've done this in real time and are doing this as well. But for I think the way we purposed out this webinar also is for um, to message out that for those who don't feel like they can't physically give or support the community or do something during Pride, or if they're not able to give financially to an LGBTQ organization or volunteer at an event or go to a Pride parade or go to an event, a real active way is to give blood also and to help share this with community members or with people who are LGBTQ in your family. Or speaking from a marketing department, do you have LGBTQ people in your workforce as well that you can tap in and help super serve their communities and where they show up? And I see Michael, you've unmuted, so I'm going to toss it over to you.
Yeah, I mean, you're absolutely right. I think you should start first by going to ABC. We have lots of material there. A lot of blood centers have their own donor recruitment department. So, if you want to reach out to them, like, how can you guys help spread the word? Our donor recruitment, they're in charge of, hosting blood drives, scheduling blood drives, and then helping, get the word out for initiatives like this, as well as the marketing department work hand in hand. But I would just even go to your nearest blood center, whoever that may be, and ask them like, how can I help spread the word with these changes to the LGBTQIA plus community?
Can I also jump in? Sharing that
It's
individual personal story and being that person that can answer those questions that can connect with the individuals. One of the things I know Jed mentioned, the advanced study. One of the things that we saw with recruiting for the advanced study is that having resources that were local to your community made a huge difference in how people connected with them. So helping support your local blood center in reaching out to your community, the people that to be that voice, to share your story, to go on social media, share your story, and say, if you have questions, I'm here to answer them, really can be a huge piece of the puzzle. Someone they can ask questions if they're not sure how the process works or what questions they should anticipate being asked and all of those things. I think that's one of the things that we've really seen, that hyper local messaging is really the secret sauce, that power in your story, as Tony always likes to say.
Thank you, Diane. Retweet to all of that. And to Aubrey in the chat also asking, does anyone find there is resentment in the community and donors will not donate because of the past? I see Dylan nodding. Go ahead, Dylan, go for it.
Yeah, I can speak to this. I have led Pride efforts in Denver for Vitalant for the last 4 years. And Aubrey and I actually have the privilege of working in the same division. Yes, we experience it quite often. We will go out into the community and say, hey, things have changed. We'd like to bring, everyone in that can. One thing that I like to tell everybody is we cannot change, the past. And we have to kind of, again, bring that piece of education forward and say, this was not Vitalant, this was not Ponfreeze Blood Center, this is not, Gulf Coast Blood Center. This is the FDA, and we have to do what the FDA tells us. But what we can do now is say, this is what's changed, and this is the impact that it's going to have. And like Diane said, sharing those personal stories. Um, but yes, there is still very much thick weed to get through, with resentment and, you shut us out for so long. Why are you here now? But it's just going to be a continuous uphill battle to bridge that gap, especially in our communication and education.
Beautifully said, Dylan. Thank you. Coming in from Francine, I feel like I'm not on a radio show right now. Coming in from Francine in the chat, the materials on the website are great. Thank you. The question is, can we co-brand those with our specific blood bank information, logos, website, etc.? 100% yes, you can. And I'm going to drop in a special link as well. As long as you are an ABC affiliate? Question mark. That's the Toni Morrison phrasing. Diane, jump in if you need to. You're also free to use the GLAAD logos if that's helpful for you. So I'm gonna drop in my press link as well. My door is closed. My team does not hear me handing off logos, but please use and co-brand if that will help you in your communities. 100% yes. And looking through here, I think we got through everything and we're like a little light. So I'm so happy to give a few minutes back to everyone. But you know what, actually, Dr. Golan, I do want to ask you a quick question here at the end when it comes to the idea of keeping the blood supply safe, which is what we all want. If you could speak to a little bit about the realities of keeping the blood supply safe and the negative narrative about letting LGBTQ people into this pool. But also, what is the research out there that may suggest how much more blood can be added to the blood supply as a result of this kind of expansion of the blood pool?
So it's a little embarrassing in that when you take away the MSM questions, we have no way of tracking how many new donors there are. Almost every blood donor center has 15 to 20% new donors every year because there's lots of high school drives. We do know that, and I'm part of what's called TIMS, Transfusion Transmitted Infectious Monitoring System, which is FDA sponsored, and we look at the rates of the positive tests, and they have not changed one bit. If anything, they're a little bit lower since this change. So there's absolutely no worry or concern that this change has had any negative effect on the safety of the blood supply. So that's the first and most reassuring thing. With regard to a previous thing, we are required to do many tests, and one of the tests is hemoglobin. And if people are rejected for low hemoglobin once or twice, they often don't come back because no human being wants to be rejected, as you've pointed out. So it's not just the infectious disease testing that loses us friends. It's other FDA required tests as well. But those are at least intended for the safety of the donor. I will leave it there.
That's great. Thank you for that. And listen, we were coming in hot and we're coming in on time with this webinar. We're really excited to have everyone donating with pride. Thank you to my panelists, special guests, ABC staff who were made to be here today. Thank you so much. But to recap, help get the word out by donating blood, schedule that appointment for yourself and your household, review the FAQs, find a location at americasblood.org, host a blood drive party yourself, get everyone on board. And I did want to add for anything surrounding telling queer stories, guidance around storytelling for queer people and issues. That's my team here at GLAAD. You can reach out to us at GLAAD.org or press@GLAAD.org. That hits me and my team. But I do want to drop in into the chat my GLAAD media reference guide. It's not prescriptive, but it's pretty intense. It's our GLAAD guide for reporting, mostly for journalists and creators. But it's a great GLAAD Bible to go to, even if you are needing just to read up through terms and the glossary and how to talk about queer issues, especially transgender issues right now. It's really important to self-inform yourself, but also ask for help for issues that you may not feel more familiar with. The key is just asking around and tapping in that community for help. And we are so here to do that. So thank you, everybody. That brings us to time. Appreciate you all for being here and happy Pride.